people, but I think we have a quorum. We have 11. Is that right? So we will get started. First thing on our agenda is roll call. Carol? Here. Mary Jane? She said she was coming. Carol, did you talk to me?
I did not.
Katie?
Here.
Butch?
Here.
Vanell?
Here.
Vicki? Phyllis? Here. Snitty is not coming. She's at a funeral. And Donna had a medical procedure. She's not coming. Mia? Angela?
Here.
Matt?
Here.
Kevin?
Here.
Shannon?
Here.
And this, and Tanya.
Here.
Everyone, this is Tanya Christopherson. She's our new member from
Hey,
school
nice to
food
meet you.
service.
Well,
Next item on the agenda is approval of the agenda. Do I have a motion to approve the agenda?
So moved.
Butch?
second.
Second, Carol. Is there anyone from the public here for public comment? Nope. All those in favor? Say aye.
Aye.
Anyone opposed? All right, approval of the minutes that were sent out. I need a motion to approve the minutes.
So moved.
Burnell,
Second. Yeah.
second Phyllis. Any public comment? All those in favor?
Aye.
Opposed? Next item on the agenda is Mr. Fontaine from HUB. We all got Trish sent me the HUB report early, and I sent that out to everybody. I think Tanya and I are the only ones who printed the thing. But does everyone, you did too, Phyllis did too. Does everyone have a copy of the report? Okay. Mr. Fontaine?
All right. Good evening, everybody. It's good to be with you. Obviously, we'll be sharing reporting here first half of the year from January through June, and we'll go ahead and get started. As you can see here, participation up at the top has ticked up just a slight bit. It's actually less than 1% here. We're at 5,734 as compared to our average of 5,696 previous year. You see our gross claims here, medical at $14,137,995, prescriptions at $11,313,717. Total claims on a gross basis at $25,451,712. It's easy to see that we're doing better because if we look at the prior year, we were at 55. For the total year, we're at 25 here for a half a year. Our plan reimbursements up substantially. We're almost at what we collected last year for the entire year in plan reimbursements within 6 months at $6,407,808. Same scenario with the retiree drug subsidies at $1,007,797, giving us a net claims figure of $18,036,107 compared to the $46,663 from the year before. Total fixed cost at $2,509,000. Humana premium $315,991, giving us a total plan cost as of June at $20,352,607 as compared to the $51,213,217. When we break this down to the total cost per employee per month, we're at $592 as compared to the $749 from the previous year, and this is representing 21% decrease. This does include in the reimbursements the COVID reimbursement, which was not captured last time, but even without our COVID reimbursements, our reimbursements are up almost 40% at 38.2. So good news on the first page with our overall figures. When we break this down more accurately into a per employee per month figure, Once again, our participation up less than 1%. Our medical claims down some 15.6%. Prescription drugs on a gross basis up 1.2, okay? But we have a significant decrease in prescription drugs when we take into account our reimbursements. Total claims down some 8.9%. Plan reimbursements up 67.2%. Now that does include the $1,123,000 of the COVID reimbursement, but even without that COVID reimbursement, up substantially, nearly 40%. So it's the decrease in claims, it's an increase in revenue coming back to the plan through rebates or reimbursements, things like that. Total fixed costs, you'll notice, is the same on a per employee per month basis, has not changed at 60, so we were successful in not having any kind of increase in fixed costs from last renewal. Our total Blue Cross costs down some 21.3%. If you remember, we had a slight decrease in our rates from Humana, a little less than 1%, so our total plan costs down 21%. Our revenue from funding down about 1.6, and of course you'll notice that we had a slight uptick in participation. So why is our funding down? Just more singles than families, and at the same time we have folks that have migrated to a different plan. So all of that averages out to just a slight decrease in funding. Net employer costs down some 28.3%. So significant decrease in cost. I will tell you, with the summer months coming up and that type of thing, obviously we built a little bit of a surplus here, but this can go away as quickly as we got it. So I know that we're all happy to see these numbers, but we don't rest in looking for cost controls and opportunities to create savings into the plan. I can tell you the month of July is a doozy. You've got 5 weeks in the month of July from a claims run standpoint, and I've shared with you in the past that a break-even week is a little over 600,000, and all we've had some 7s, 9s, and we've had some 7-figure weeks in June. So we will probably see a good portion of that surplus drop in July, but we expect that in summer months, and then of course normalization, and then all of the additional reimbursements coming to the plan. I guess summary word to this is obviously this is real good reporting, but we are going to have some months during the summer that are going to be high and then normalize back in the fall. So all this being taken into account, shared with you the percentages here, okay? When we look at it on page 3 on a monthly basis, obviously you see where our high-cost months, low-cost months were. January, pretty high in costs, and of course May being a $5 million month. July will be a $5 million month. But we're still in good shape here, and we do take into account that you see when the rebates are coming in, you see when the subsidies are coming in, and all quite nicely. Next is just on a fiscal basis, completing the year through June and having a bit of surplus there at the $2,684,000. Does include, you see in the month of February, that $1,235,661 in COVID payment. Remember, at March we were at a slight deficit, so we've had quite a good quarter here. We knew that things would be normalizing after the COVID, and we have had a significant decrease in the number of high-cost claims as well. From an enrollment standpoint, we talked about, yes, Butch?
Okay, on the pages here, the Humana retiree count changes in every one of them. Is there a reason for that?
The bottom number on
The bottom
Humana-
number, yeah.
Yeah, because your average changes depending on ups and downs in enrollment. So it's an average
Okay.
over the period of time. we're
Oh,
reporting.
okay, all right, cool, well, I just, gotcha, thank you.
So that number is always going to be reflective of an average of the period of time we're reporting, and at the same time, if you see numbers on a particular month, that's who the enrollment for that
Well,
particular.
it's only a couple, it's not like, 100 or two, it's just a couple, right?
Yeah, so you're going to have folks ebb and flow
Right.
out of that enrollment number.
Okay.
On page 7, good news here as well, because the single component, our employee only, grew some 1.7%, employee and family actually down about 1%. So we've talked time and time again as with regard to the difference between membership and enrollment. And in some cases, higher claims on spouses and dependents and that type of thing. So the demographics are obviously moving in the right manner. Enrollment by plan means we're not really close to any type of open enrollment. It's not changed much from what's been previously reported. The enhanced plan enrollment's down slightly, while basic and Blue Saver obviously having the biggest increase, but not much of a difference, 0.9% there versus 0.7% of growth on the basic, and then enrollment coming down on the enhanced plan, which is all positive because the enhanced plan obviously has the highest claims. From a membership standpoint, remember enrollment was at 0.7% growth, membership only 1/10. So obviously the number of belly buttons insured by the plan is not having the same growth as that of the enrollment, which is a positive thing. Page 10, I had spoken earlier to the fact that we have had a reduction in large claims, which has been favorable to our medical numbers. So I'll take you to the bottom bullet here. In this period, and this is measuring the same period of time. This is not comparing you to the full year of 2021. This is comparing to the first 6 months. There are currently 27 members with payments between $50,000 and $400,000, okay? As compared to 48 the previous year. We're comparing 2,791,018 to 4,569,463. Folks, that's $1,778,000 that we've had less in high-cost claimants. So obviously a good thing there as well. On the prescription front, our inflation trends in this are all right at double digits, depending on the folks reporting that. It's anywhere from 9, 12 to 13%. Yours has increased 1.2. But while we've had an increase of almost 12% on our high-cost medications, our net costs after all of our reimbursements has decreased 22.8%.
It's amazing.
So that's because of the higher rebates, the larger discounts, all of that has come into the plan and helped us out greatly. So all of the different things that we've done with regard to the negotiations on our contract and that type of thing has fared out greatly for us here. From a total claims perspective, down some 8.9%. So when we couple that medical and prescription drug savings in there, looking good from that front. This is a bit repetitive, but it's mostly the bullets at the bottom that we concentrate on here. We know that we've had a decrease in enrollment on the enhanced, and that's being migrated to the basic and Blue Saver plan, a little more towards Blue Saver, but that's just from a percentage standpoint. You'll see that the enhanced plan garners some 15.1% of the participation, but 21.5% of the claims. Basic plan closer to breaking even at 62% of the participation and 65% of the claims. Blue Saver, with the highest stats in this area, 22.6% of the participation, but only 13.5% of the claims. So obviously, the Blue Saver is supporting some of the higher cost in the enhanced plan and basic plan, not quite, but coming close to breaking even. Total plan cost, once again, on 14, down some 14%. Lower claims, higher reimbursement, no change in fixed costs. When we look at claims by type of service, this is an excellent report too here, in that you'll see a decrease of some 32% on our inpatient hospitalization. That's where the real money is spent there. Outpatient also down almost 19%. Professional still hanging in there at only a 1.5% decrease, but we all know the doctor's offices have been pretty full, especially with all of the sinus infection and ongoing COVID checks, things like that. Top inpatient diagnosis, and this one's an important one to me because, you know, when I look back to 2017 and you go further and we've had all of this talk about musculoskeletal, I've got good news around the Regenix program that is taking a lot of this away from us, okay, and has really gotten some good traction. But what we all don't really talk about and realize, it's not just the difference in the cost of the surgery. It's the difference in the cost of the outcome. People come back to work, they're productive, you get to escape all of the narcotics, and I compare my son with sitting in an easy chair, having to sleep like that for 6 weeks versus a buddy of mine who walked out the office with a Band-Aid and a little script for some physical therapy, and both had the same outcome. Matter of fact, my son's kind of young, he didn't do his physical therapy, and now his shoulder hurts again. That's here or there. So that's a good front. You see a real downtick in circulatory, but even more important, a pretty good outlook. The neoplasm hasn't come up as much as I thought it would. So all of this being with a 32% decrease on the inpatient, that report looks very well. Factors influencing health on page 17, we talked about before, that includes chemotherapy. So that to be on the way down is always positive. But really the only area that's gone up in this is musculoskeletal, and that you want it to be because those procedures are being done on an outpatient basis. Finally, with regard to musculoskeletal, what really is the cost driver of those types of surgeries is when one comes up with complications of infection, okay? I had a friend at my house last night, broke his ankle, fell off a ladder. First surgery went fine, then he developed some infection, and he's been through 3 additional surgeries to debride the infection. He's gonna be fine, but the cost of it is astronomical. It's not just the cost of fixing a broken ankle, it's the cost of 3 additional surgeries. When you walk out of a doctor's office with a Band-Aid, you didn't have an incision, obviously infection doesn't come into play, a lot less claims dollars, so good news around that front. Top facilities, do not be alarmed or alerted that, you know, for the first time that you see Lords ahead of Lafayette General, we had a 32% decrease in our inpatient spend. It's just where some of these procedures landed, that type of thing. So really not much discussion there. And then obviously our facility numbers are way down. There is also talk of a lot going around, not just statewide, it's nationally. We had a pandemic, hospitals took a financial beating, okay? They're all looking to negotiate contracts. So the fact that you are with the provider that has the largest network, that probably has the best ability to negotiate a contract based upon supply and demand, serves well for you as well. You
Is
know?
Park Place Surgical included with Lord's?
Yeah.
Is
Ma'am,
Park Place Surgical owned by Lord's?
are they owned by Lord's?
They're owned by some doctors.
The doctors.
Doctors,
So it
yeah.
doesn't have, it's just physically located there, it doesn't have any affiliation with Lord's?
I'm saying.
So it is a network, obviously, but all that being said, everybody's going to be looking to for a raise to make their ends meet financially, and at the same time will be served well by the fact that, you know, the entity that we utilize for our PPO network has such large market share. They ought to be able to do a pretty good job in that negotiation. Prescription drug utilization by number of scripts, we went from 85 to 88. You folks have been doing the right thing all along. The only reason we really dipped down to 85 is because you had the brand name vaccines mixed into that data. Okay, so it's not that we had a lull in people using generics and going to brand name medications. That did not happen. We probably gained steam during that time in generics. It's just that when you mix the data in with the number of Moderna and other manufacturers' vaccines, that number, that percentage becomes a little skewed. 21 is also a really good report too. Per capita, we're taking less prescription drugs here. On a per employee per month basis, about an 18% decrease in that. And on a per member per month basis, almost 19. So less utilization always means less claims. Okay, not always, we could have some high dollar ones, but in most cases. Top 10 drugs by number of prescriptions, okay? Only a few things that caught my eye. Obviously, an acid reflux medication should probably not be number 2. I mean, if any of us would never look at this report, we thought maybe think that a cholesterol medication or an antibiotic or something to control high blood pressure would be up there. They are there in your top 10. But a lot of acid reflux going on right now, obviously. I am pleased to tell you, and I've told you this before, because I'm fortunate enough to do a lot of municipality business. Y'all know I have several other large school systems and things like this, and a lot of that reporting is riddled with a lot of anxiety and depression medication right now, okay? Yours is not, okay? So that maybe make the folks here in Lafayette a little saner than the refugee station. I'm just trying to pay all left-handed compliments. Take it, and it's good-looking numbers, because every time I see that, I go direct to really trying to impress upon folks utilization of your employer assistance program and things like this. I'm a big proponent in finding out the root cause of something and getting treatment for that, rather than masking it with a medication, because in all honesty, you can call a primary care physician and get one of these strips over the phone in many cases, okay? So,
Do these other entities have EAP programs?
what's that?
Do these other entities have EAP programs? I know we have a very active EAP program.
All of the other entities have them, but they don't educate to it or utilize as much as you guys do. Y'all have always had good utilization of the EAP program.
We're well above the national average of their employees that use EAP. There's been a great deal of time pushing it out.
Yeah. And a lot of times, a lot of those issues are resolved with pre-court visits, and it doesn't even produce a cost to the health plan.
It's good to know that the investment, if we're paying that, the investment's paying off and saving.
Absolutely.
Yeah.
And
Yeah.
it's a good return on the investment because EAP is a very, very inexpensive benefit. It's not very costly. Top 10 drugs by dollar amount. And I always use this statistic. This is less than 3% of your prescriptions and almost a third of the money. I'll repeat myself. Less than 3% of your prescriptions are driving almost a third of these millions of dollars that we're spending on prescription drugs. Just a short period of time ago, prescription drugs, 12-15% of the total. Now, first pages show it over 30% of your money. So quite important. We've done a real good job of tackling this cost and bringing the higher discounts and rebates into the plan. We had a 12% increase in our top 10 medications, and that's not because the cost of the top 10 medications increased, because you've got more utilizers of these meds. 2 of them at the bottom are new. Many of them on a per employee per month basis haven't changed, like the Humira, Trulicity, Eliquis, things like that. Actually, Eliquis is a little down. You have a new angioedema drug in the middle. That Takhzyro is an angioedema drug. That drug is in excess of $30,000 a month. It keeps people from alive and out of the hospital, and it's rare, but I do have several of them in other groups and all. So even though you have this increased utilization and high-cost medications, remember you've got a 22% decrease. So the power of rebates, the power of discounts, and the power of negotiating certainly fared well for you. PPO savings on page 24, we ticked down 0.1%. We had a lot less facility charges, so I was thinking it would be more than that, so I'm pleased with that 69.9% all day long. From a in-network standpoint, still at 96.9. If I were sitting in you guys' seats, I would say, well, then we went from 98.3 to 97.3 to 96.9. If you remember from last meeting, it's Dr. Bond. It's a good thing. It's Regenix. He's the #1 non-network provider at $164,749 of charges. And with his procedures not being high cost, he's done a number of them. Cost breakdown on page 26 from a fixed cost versus claim standpoint. Do not be alarmed that your percentage of fixed cost went up, okay? Reason being, your fixed cost is still running you $60 per employee per month. We were successful in skirting any type of reinsurance increase or increase in administrative costs. Our averages have stayed the same here. It's just when we pay out less in claims, the fixed cost becomes a higher percentage of the total. Contribution analysis, just because of the folks going from enhanced to basic and our high deductible health plan, Blue Saver, as well as more singles than families. We've had a little bit of a tick down from 223 to the 215 on the employee cost average. And obviously, with plan costs going from 749 to 592, that brings our board cost down a bit, and obviously the funding, when you move from one plan to another, from enhanced to the Blue Saver, that type of thing happens as well. The second to last page is the sheet that compares the same period of time, some of this covered in the beginning of the reporting. Bullets are still the same, but it's very easy to see where the bulk of the savings were in large claims, anywhere from $20,000 all the way up to $400,000. And year over year, we're about $2,156,000 better off when measuring the exact same period of time. And remember, we've got a little more employees, so if we did this on a per employee per month basis, it even becomes a better comparison. Last page in the reporting, always a summary of bullet points that kind of highlight what I've been going over here. And once again, costs down some 21%, lower on the medical side, but much higher reimbursement on the prescription drug side, only a slight increase in our gross number on the prescription drug side because we've got lower overall utilization there. That has offset the increased utilization of the high-cost drugs. No change in fixed costs, so good-looking report, comma, but 5 weeks in July, $5 million month in July. We continue to watch this like a hawk every Monday. Brooke and I like this because we get all of our numbers on all of our cases. I can easily look at your number and say whether we're in a good or bad posture. I expect high numbers in July and high numbers to continue probably through the mid of August, and then things calm down. But right now we're in good shape, but we're not resting.
Anyone have any questions for Mr. Fontaine?
I have a question.
Shannon?
So Dr. Bond, who offers the Regenix procedures, is not in our network.
He'll never be, that's not a network type of procedure.
No, I know it's not a network type of procedure, but I know that he is also a general practitioner, and he was in network until about 2-ish years ago. Would there be any way we could encourage him to accept our insurance if there are people who seek out care from him for Regenix and then wish to continue seeing him?
Absolutely.
What can we do?
We'll make a request for that tomorrow morning.
Okay, great, thanks.
That's an easy one.
Yeah, I didn't know. I honestly didn't know if that was within the
Networks
realm of
are kind of
possibility.
any willing provider. Obviously, he's got agreed to the contractual terms of the discounts and all of that kind of thing. The only reason I'm thinking that he might not be participating anymore, he might not practice much in a general practitioner, if any. He might just be doing 100% of his work in Regenix and doesn't see any patients on that. We'll find out for you and get right back to you.
Awesome, thank you, I appreciate it.
Anything else?
Can
Good?
can we see, of course, in South Louisiana, we have a lot of diabetes. We had a discussion at the last meeting with the Libra and the Dexcom 6 or whatever, and how for some people, they can see what foods affect them just readily without having to be, without a stick. Is there a way we could maybe look at that? Because if I remember correctly, when we had the other lady come from New Orleans, she was going to get us Dexcom. It was 5 at the time, Dexcom 5, and it was at no cost to us per se. We would get the supplies, et cetera, et cetera. But then, of course, the cost. I think the plan was like 50 cents per employee per month. That was given to them. Can we look into something like that? That would perhaps.
In some cases, that can be very cost effective. In other
Yes.
cases, you've got folks that probably don't medically necessarily need that type of monitor and all. And boy, everybody wants it because it's so nice and
Oh, yeah.
and convenient and all of that. So there's a little, bit of pro and con to that. But there's probably 4 or 5 of those programs out there that lead the industry. You mentioned a couple of them. We'll look into that.
If you don't mind, because that way, and I think it in the discussion and whatnot, you know, if you're eating, if you have a lot of spaghetti, or, you know, you're into something else where you might be doing a lot of the steaks and stuff, you may see a decrease, but you can check that readily. And that's
What Butch is referring to is a real-time monitor, so this lets a diabetic know it, and it's also integrated with his physician.
right.
It's integrated with the plan, so the member has the opportunity to constantly have his diabetes checked on without pricking a finger and waiting for results and all of this kind of stuff. And obviously, everything I just said is positive, positive, positive. And from a plan perspective, obviously, a controlled diabetic is going to be much more cost efficient than an uncontrolled diabetic. At the same time, it can possibly lower need for the degree of medication that you take, because if you're monitoring and checking regularly and taking care of your diet, you might not be at that level of medication. So those are all positive things.
And then not only that, the diabetes also leads to other things, the eye situation,
Oh, God,
comorbidities
like crazy.
there's just, it's a myriad of things and whatnot. So if we could monitor that, a lot easier than pricking your finger 10 times. Part of the thing that you have for Medicare, there's certain requirements to be able to get it, okay?
Right.
Yes,
And that may be
That's what I was
like,
referring
that's the
to.
problem.
yeah, you may have to
That's the problem.
prick yourself 10 times a day and whatnot. That would hurt.
Everybody wants one, but not everybody
But not everybody can
qualifies.
get it,
That's
right.
where it gets
Yeah,
That's
but
true.
tough.
I looked into it, and that's what I found. But then again, on the other hand, if we could just go straight to the company and perhaps just kind of maybe do some
Maybe we can
negotiations,
get
and,
with them.
you know, I mean, they're gonna get a certain amount, and
They're a lot more pricier than your
Oh, yeah, I know.
monitors and all of that kind
Yeah.
of stuff. And anybody who, God forbid, suffers from diabetes would obviously like all the bells and whistles of that monitor.
But it's not easy to get because I have an aunt, and she's legally blind because of diabetes. But she had to go through a litany of things before she could get it. She
really,
had to try this and then this and then this. Now she has it and she loves it,
well, of course.
but it took her a while to get there.
But what I'm saying, when we had Takia from New Orleans, she was going to get that. That was part of the program. In other words, when she gave it to us and whatnot, she said she could get us on this particular program with. And at the time, it was Dexicom 5. Now it's Dexicom 6. But maybe it was a negotiation with the company directly. And I mean, that's just what we were given now, you know, and we were going to come out with that. So
We'll look at this.
it's just something to look into, if you don't
Absolutely.
mind. I mean, I think that would be beneficial to us if we could.
Because
do that.
outside of the high dollar anti-inflammatories and some one-offs, obviously with the angioedema, diabetes is the prescription drug driver.
Oh, yeah, it is.
And, you know, but you want that on the pharmacy side because we don't see nearly the number of kidney transplants and end-stage renal disease or folks in the hospital with amputation and debridement and all of this. So the medical numbers come way down, but the prescription drug numbers come way up.
Anything else for Lynn?
I do have a comment to make with a question, but at the last meeting, I had a question about the anesthesiologist being covered. I was given incorrect information from the Blue Cross representative, and I want to thank Brooke, but she got back to me the very next day and clarified everything. We do have many anesthesiologists in town that are covered on our plan, and that was not the information I was given, so thanks, Brooke, and you did it in a very timely fashion.
No problem. That's
All
what
right,
we're
so at
here
our
for.
next meeting, we'll hear about Dr. Bob and whether he'll be in network and get the information about the monitor. Anything else? Thank you very much. If not, we appreciate it.
Thank you.
Thank y'all.
Next item on the agenda, 2.4, vacancies. Discussion and/or action regarding the employee retiree insurance advisory committee vacancies due to retirement, resignation, and excessive absence. I'll need a motion on each of these, a motion and a second because we'll need to declare the positions vacant, if that is the will of the committee.
Miss Nancy,
Yes.
can I stop you just for a second? Historically, you don't vote on resignations or retirement,
But we're creating a vacancy so I can report it.
but it's not, so let me give you an example. Keith Johnson, Clyde Stansberry, Melanie Abear, all past previous members, you never voted on it prior to making it an open position.
Tricia, doesn't matter to me, what is your preference? You
Well,
have to vote on one of them, because it's
historically, you don't vote on it because it's an open position. It's a vacancy currently that's been communicated prior to this
If you
point.
prefer, I will just read the ones that are vacant, but there's one we have to vote on, because of
Okay.
the bylaws.
Yep.
There's a vacancy in the Apple position. That is Deborah Thrower, who is a longtime member. She really wanted to stay on the committee, but she couldn't teach anymore. She was exhausted, so she retired. The LPAE representative, Chris, who was with it just a brief time, resigned from the system. He is going to work at a charter school. Michelle I did not get her resignation, I got it from Trish, she apparently turned it in to Trish. She was also an LPAE representative, so LPAE has 2 openings. The 4th opening is the one our bylaws require us to make a decision on, and that is due to excessive absences, and I think our bylaws allow us, see if I can find it. I think it's towards the end. If members of the committee shall attend all meetings and review all materials that are presented, members are expected to communicate with and seek input from employees and retirees. If a member is unable to attend a meeting, he or she shall notify the chair, who shall document and excuse absence. Repeated absences from committee meetings may result in removal of a committee member. The one person that we have that falls into this category is with us tonight, is Angela Lee. And Angela, I'll let you speak for yourself.
I would like to stay on. If I can't, I understand. I had a lot of issues with my mother, and she's elderly, and I just couldn't make the meetings.
Do you think you will be able to make the meetings in the future if you stay on?
Yes.
Okay. Is there any motions?
Have we ever, I've been on this a long time.
We have never.
So that's my point. So if we have never, and, people understand they have to notify the chair, because stuff comes up.
Yeah.
And if you're still willing, I'm just trying to understand why we're doing this tonight.
My only pause would be, while I totally sympathize and understand Miss Angela, I do understand. Miss Angela hasn't been here in 8 or 9 meetings. So in my opinion, personal opinion, I believe that's excessive and we should have addressed it long ago. So what my only pause would be, what is the definition of excessive, and could we better define that if you update your bylaws?
Well, it's not the issue of excessive. It says even with excessive absences, that may be a cause for removal. And Angela and I spoke probably maybe several months ago, and she was leaving town to go to a funeral for a family member in Florida. So it's not that she has been totally out of touch.
Your fair and equal representation is a big point with regard to when we were discussing the bylaws too. When Miss Angela, or let's just say Miss Carol's not here, that's not your fair representation of the specific job that you broke out with regard to your insurance committee members. And I know that we went around, we had several discussions with regard to it, and my only pause would be, it's not being represented. Paris, in that instance, are not being represented.
They have not been, but
Right.
she just indicated she would be able to
Right.
attend in the
And
future.
I can remember in the past, I was a substitute for Claire. Can't remember Claire's last name, it's been that long.
Yeah.
I was her substitute. So when she could not attend a meeting, she would call me.
Right.
Then I would have voting rights. Can we do that? I mean, you have certain
Proxy
exceptions.
voting.
We would have to revise the
Proxy
bylaws.
voting, and we don't.
And I kind of agree with you, Trish, that we probably need to have a certain set number of absences
Yeah.
for the committee to consider it.
Right.
And if it's in the bylaws, I think it'd be a lot easier to do. But I agree with you, I was the big proponent of representation in groups, if you remember.
Yes,
So
sir.
I agree, and I think it's important that people attend, and we can't always attend all the time.
Right.
I took care of my 101-year-old mother for 6 years.
Yeah.
So I understand, but we also need to make sure that representation is there. So
Right.
I agree, and maybe consideration in the bylaws of some kind of guideline with that, rather than an open statement.
And it would have to say shall, it would have to be a requirement.
But how did I become a substitute for a member?
That was
Was
the
it
old
nowhere in the
bylaws.
bylaw?
We didn't
Because-
even have, back in those days, we all sat in the audience. We didn't even call a roll back in those
With
days.
the updated BBC, you're now open meetings law requirements, and you cannot do proxy voting with regard to BBC. So when that got changed, that changed how y'all do the proxy.
Shannon?
It seems, just in hearing the discussion, that the bylaws as they are not sufficient for us to fairly determine what to do.
Well, there's
In a way that's fair.
Good point.
So, to me, I mean, my recommendation would be that we revisit the bylaws to make more explicit guidance. But I don't think that it would be fair to make a removal with the bylaws in place as they stand. Because there hasn't been,
And it's in
that-
the report to appoint a bylaw.
that clarity is lacking, and I just don't think it will be fair.
And back then, we didn't have as many people on the committee.
No, we didn't.
No.
We couldn't get people to come to, we couldn't have a quorum for years. We had no quorum, we just had meetings,
We just did.
but we just did it. And it worked too, that's the
Yeah, it did
good
work.
part. So is there any other comment? Is there a motion? If there's no motion on the floor, then Angela, we hope to see you at.
I say we're glad you're here.
I will notify Mr. Angel of the vacancies, Apple and LPAE 2 and Apple 1.
Miss Nancy,
Yes, ma'am.
as we get resignations in, because there's a 3-month window before our next meeting, since we don't vote on a resignation to go to the board, can Ms. LaBeouf just contact you, that way it can go to the board, so we don't hold off for every 3 months? And then it holds off, and again, so that representation continues to linger with a balanced representation. Do you see what I'm saying? So when someone retires, let's say someone resigns in April, we just had a meeting in March, instead of waiting to the July meeting, if Ms. Trish could contact you, and then you could reach out to the board president to where we could get it moving to where we wouldn't have to wait 6 months before we vote.
I can do that, but I also think the committee has a right to know who is no longer on the committee before I report it an opening to the board president. That was my point to Trish when she asked me to do that.
But in order to keep the balance of equaling representation, if we keep holding off, then it's almost 6 months before we get anybody to sit in there and vote.
But if not, if we had done it that way, we'd have gone to the board 3 times for these resignations. This way, we're going to go once. So,
But I would say do it consistently, because the previous members, when we added Chris Mailer, when you added Vicky So, Keith Johnson, when all these members left, you immediately notified the board president. There wasn't a conversation with the committee. So I would say add some consistency if that's the case.
well, if I were a member of this committee, I would like to hear that someone has resigned, retired, whatever.
And we
I
can
would
do
say
that
put it in your bylaws to give you additional
Send an
direction.
email so that when someone resigns,
Yeah.
As long as it's after the effective date of the time of the
Absolutely.
resignation.
Yeah. And I would encourage any member of the committee, even though we don't have proxy, is have somebody represent you here just for information purposes.
Yeah, you don't have to
If
vote.
at all possible, if you can't come, find somebody in your group that can come and at least hear.
Does that need to be in the bylaw?
Well, we're
That's my
gonna
question.
Now, they
redo
can't
bylaws.
vote, but
They can't
I don't think you can vote, but
they,
can
I don't know if you can.
I'm waiting for just like Anthony's here to just kind of.
Because he's
Get
bored.
Soak it in.
All right,
Not bored.
anything else on 2.4? 2.5, responsibilities is defined by board policy and the bylaws. That was sent to you by Trish, both the board policy and the bylaws. And this refers to an item that we brought up at the last meeting that Katie asked that we discuss again, because we weren't able to discuss it last time. So, Ms. Langford?
First of all, let me say I appreciate you putting it on the agenda. I mean, I think it's only right for a public body that's funded through taxpayer that we be able to discuss transparency, okay? And part of the bylaws state that we should be transparent with our dealings to the board and our recommendations to the board. And I feel that, I'm going to be honest, and I'm not trying to criticize, but we need complete transparency from the committee and from staff. And as Ms. Gardner said at the last meeting, yeah, part of what brought this on was the reclassifications, okay? And had we just known, and I know one philosophy is that doesn't affect programs, but it really does because it affects the budget, or it could affect the budget. Therefore, and let me give you an example, just the year before the first reclassification, we had the increased premiums and we decreased a little benefits. And then the following year, we come with reclassification. And I can't determine if reclassification is justified or not. That goes before a committee. I used to serve on that committee. And then, we come back this past year, and there's another reclassification of the rest of the department. So the whole department, I think, was reclassified. And originally, the recommendations were to come out of the insurance funds. And I think we kind of found the agenda, and, the board was nice enough to say it's coming out of general fund. So it did not affect our insurance funds, but it could possibly. Am I opposed to reclassification? I served on the committee. No, there are instances in which it's needed, and there are instances when they were denied. But can we just be transparent so that we can make informed decisions or recommendations to the board? And I'm not accusing anybody of anything, but I think also the bylaws say anything in the budget or budget revisions, and that could have been a budget revision. And that has to come before the committee. The board can do whatever it pleases. It can accept our recommendation or it can deny our recommendation. But I kind of think since we're self-funded and this committee is to advise the board on things with insurance, could we at least be informed before this is presented to the board? That's the point I'm trying to make.
Anybody have any questions or comments?
Well, I've been a member a long time, and a lot of people disagree with always the self-insured part, the monies that employees put in, retirees put in, that money is taken from that to pay salaries, to pay increase in salaries. So whatever we have to do, I'm going to ask, I want it on record, that be the last thing we do. We understand that people have to be paid, but I pray to God that it comes from the school board rather than money that's self-funded, and then employees or retirees have to take the brunt of it with an increase in premium or a decrease in benefits. That's the only statement I'm making.
And I think the concern was something that is funded with the general fund this year may next year be presented to us as funded in the self-insurance fund. I mean, there's no, like Matt said at the last meeting, when he was asked, can you guarantee that a reclassification funded in the general fund will stay in the general fund? And he said, you can't make that promise. So, which I understand. So that explains why it's important for us to know what may or may not end up in a budget that affects, as Carol said, the premium.
And had the board not picked it up from general fund, that would have increased our fixed
Yes.
costs every year, okay? That's the point we're trying to make, guys. I mean, you know, I've seen reclassifications, and I'm not arguing that, and then we do part of the committee reclassification one year, the rest of the department the next year, and then there's a reorganization. And I don't know how that affected anything, and that's certainly the superintendent's prerogative to do that. I've sat through many administrations. But my point is, can we just call it King X and start all over again with transparency and report of everybody? The committee and staff, okay? I mean, the whole idea is to work together for the benefit of our retirees and our active employees. And I think the insurance department works very hard. Trish, I think you called Brooke to call me, as I recall, or you at least let me know that Brooke was looking into it. And I appreciate that, and that was very clear. I'm not arguing that people aren't doing their jobs, not at all. But I just kind of think we just need to kind of clear the air and just put everything on the table. That's all I'm
Anything
saying.
else?
And I'm not accusing anybody of anything. I think it's a two-sided thing right now.
So I'd like to make some follow-ups if you don't
Sure.
mind.
Sure.
So Ms. Katie, the department was not reclassed the year before. There was only a reclass for this year. There was 2 employees that were a part of the budget for this year. For
But the year
2022-23, no ma'am, there wasn't a reclass before. Now, there were changes within the department, but it wasn't a reclass, so I just
Okay,
wanted to
but
make sure.
there were changes in pay grades.
Changes with regard to positions becoming available, members applying for them, and then members taking on those new positions. So not a pay grade for that specific job description. The job description was eliminated and a new job description came about. So it wasn't a reclass, it was an elimination of a position based on a
Did the
reorg.
pay grade change?
It did, based on the old job description stopping, but it wasn't a reclass.
But
So,
it had the
yeah.
same effect, but I understand what
Right.
you're saying.
The other thing I'd like to note, with regard to the reclasses, they do go through that committee. Superintendent does give the approval, and it is general fund. General fund, according to BBC and bylaws, is not a part of the insurance committee's review. It's based on discretion. Ultimately, it was the superintendent's discretion once she finalized all the reclasses within the department. So I'd just like to make that consideration. The insurance committee may have recommendation based on Fund 85, but they do not have recommendation based on general fund.
But the concern is, Matt's comment to, at the last meeting, it was funded by general fund this year. Next year's budget, are we sure it's going to be in general fund? And the answer is no, but it's a recurring expense. So then it would end up in the self-insurance fund, which is why I think that raised the concern when Matt made the comment he made at the last meeting.
But I think if that did
a
occur,
question that said, could it? The board does what it wants to do.
Right.
Anything could go. They could end self-insurance tomorrow.
Right.
So yes, to answer the question, it could end up in the fund, yeah, if
Yes.
the board should decide to do so.
If it still works the same way. Reclass, there's a certain amount of money, if my memory serves me correctly, it was 200,000 set aside in general fund per year for reclass. For that year, that person is reclassified.
It doesn't apply to teachers, guys, all employees.
After that, if the reclassification is approved, then the following year, budget year, that cost center, which would be insurance fund, would pick up the entire cost. Is that correct? That's not how it works. It's changed. Is that how it used to work, Mr. Moore?
It's not always that.
I'm trying to figure out.
He's thinking about that. It's not always the cost center, no ma'am. It could be general fund.
Well, and it is,
To be
because the board
correct.
decided to do that. I agree with you on that.
No, but
Absolutely.
it's not even, I'm just trying to think of another position here.
Okay.
There was the front office receptionist last year, I'll use that. was reclassed, and that didn't come from that cost center, it was from general fund, that put that into that cost center, it didn't come from the
And it's
back
still
end of
in
the cost
general
center.
fund?
Yes, ma'am.
But the whole thing, I think, usually it's because of such large amounts of money that involved when you're doing that many people or whatever. I mean, and it's, you just as soon come to them, come and say, this is what's gonna happen. It's not like it's gonna be kept a secret,
Oh, no, sir.
you know?
And a
Because, I mean,
reclass,
it's gonna get out there, once it gets out, it's like, well, why was this or why was that? So if you just bring it to the committee and say, these are the things that are, the changes that are being made, and this is how much it's gonna cost, it's coming from here or it's coming from there. And you eliminate a lot of the things, but you keep it, like for instance, why didn't we discuss it last time? If we had discussed it, you'd know it before the meeting. What happened, it happens at the meeting, then you come back and say, well, why didn't we know it? So it's that kind of thing, you know?
When we have the budget meeting, which is in March at some point in time before the board votes on the budget, when do you do, is there a certain time of year you do reclassification?
No, convenient.
so,
You have to do it before the budget.
so we built the superintendent and the practices, I'd say in the past, 4 years, we've been through it, we talked about it at the board meetings and
There's an
budget.
amount in the general
We've
fund
done
budget.
it through the budget process, so that way, we try to do it all through the budget process, so it doesn't pop up periodically through the year.
Okay, because it used to.
Correct, so, about 4 or 5 years ago, it's been attached in the budget process, so when you pull up the budget spreadsheets, it actually shows it now. So that way, we can always track it, and that was part of the
So
discussion.
Jennifer, when we get the proposed budget, if there's reclassification, can you just include it as an information item?
And so, and that's what, yes, but here's the kicker on it, it doesn't always come out, so this meeting's in March, sometimes that reclass is not finalized till April. So it's not like it's always hidden, it doesn't, our final budget doesn't go up to May, so it just depends. Like our budget was later this year, and for insurance,
Can you email it?
trying to
Just
get.
so we're not shocked. I mean, it was kind of a shocker, I'm gonna be honest, and it's kind of like, nothing was ever mentioned, and it was like, you know, really, just as an information, to open up communication. The board will do what the board wants to do, Matt is absolutely right, and they always have. I mean, that's nothing.
Well, that's a prerogative, they get to control a few
Absolutely.
things, jobs for the superintendent
Right.
and money.
Absolutely. So, you know, that's my request about transparency. I'm not saying it was deliberately hidden, but the fact that we didn't know and ended up looking at an agenda was quite shocking to us as an insurance committee, and, you know, and having to answer other people that looked at the agenda saying, what is this? It was like, I don't know. Okay, that's.
Anything else? All right, next on the agenda is my report. I have 2 things. First is the appointment of a bylaw committee, which will be Katie and Brunel, because they did it the last time, and Phyllis will chair it. And they will look at all the bylaws, so anyone who has suggestions, including the staff, if you have suggestions, please get them to Phyllis. And we need those, we need to have them 10 days, at least 10 days prior to the meeting when we would vote. And that would be whenever the January meeting is. It's not set yet. But at the January meeting, we should adopt our bylaws and vote on officers. So you have plenty of time, no rush. But we do need to look at it. We need to look at a specific absence and not a may, a shall, if there's an action required. I really think, my recollection is we left that may in there on purpose in case there were extenuating circumstances and we wanted the committee to have the ability to make the decision.
And that could be in the bylaws, you know, that the committee can consider extenuating circumstances.
There's also in the bylaws a specific number of meetings, and that needs to be deleted because it sometimes changes. Year before last, I think when we were going through the Eggwood thing, I don't know how many meetings we had, but we certainly had more than 3, plus our one year before. Okay, the second thing I have is, and we probably have to vote on it, is our next meeting, when we did our meetings for the year, which we'll do again in January. We did not include the October meeting. Last year, it was October 24th to 25th. The Tuesday in October closest to that is October 26th. Is there a motion to have our next meeting Tuesday,
Yes, ma'am.
October 26th?
When's
This
got a Wednesday?
This is an informational item. Unfortunately, you can't vote on it. You've got a chair report. Chair report is just informational.
Well, I can call a special meeting. So what is the date of the October?
Now, I did speak with HUD prior to them leaving. They are available on 10/25 or 11/1,
Well, we'll do it,
but
we're gonna have a special meeting on 10/25. So that will be our next meeting, it'll be a special meeting, since we can't vote. Anything, that's all I have
I'm
in my
sorry.
report?
Just question. You're not going to change our meetings from Tuesday to Wednesday?
No.
Okay.
No,
I have the
You said
wrong
the
date, so,
26th.
Tuesday is October, what's the
Okay.
Tuesday in October? Is that the
it should
25th?
be the
Yes, ma'am, the
25th. let me look.
25th.
Yes, ma'am, it's the 25th. October 25th.
Okay, Trish?
So I have a few things for the staff report. I figured I'd just fill you in. It's everything from active members to retirees. I just wanted to follow up on that Aflac dental follow-up. At the last committee meeting, there was a statement that there was 67 complaints on the retiree Facebook page. There was not 67 complaints, there was 67 comments. There was a total of 12 members experiencing some issues. So we perused the site, we got the names of the members. I've reached out to every single one of them.
Great.
All of them have resolution. There's one member, retiree member, who's still experiencing issues, but it's a problem with the dental office and the information that they will provide her.
Right.
So I'm still in tandem working with her in the dental office to try and make that resolution. But I just wanted to make that clarification, that we've reached out to the members and everything's good to go moving forward with regard to the Aflac.
Trish, I have a question. This is a strange, we were talking to a retiree who had no clue that we could get insurance, dental insurance through the school board.
You can't anymore, a retiree can't.
So you can't, he can't anymore.
You have to leave with it.
Right,
They have to have it
exactly.
before you retire.
What do they call it?
You have to have it on your payroll at the time you retire. If you do, then yes. It's portable.
It's portable.
There you go.
I was looking for the
You
word.
can continue it. Portable basically means you can continue it afterwards. So
I was not aware that you had to have it before you left.
you did, yes, sir.
Is
Everything.
is it just dental, is it all?
It's all benefits that are listed on your payroll.
Okay.
And
So whenever you
service,
retire with, you're eligible to keep as a retiree.
as long as the state
Is
recognizes you.
there a window before? Because I need to share this with people who are going to be retired.
So that's why open enrollment is so important.
She's gonna talk about open enrollment in just a second.
Okay.
Yeah, if they don't have the benefit, they have to be a service eligible retiree, classified as that per the state and per LPSS in order to be eligible for benefits after retirement and continuation throughout.
Vision does not apply to that,
No, vision does, yes ma'am.
because I pay the vision directly to the company.
Right.
It doesn't, okay.
Right, exactly.
All right.
Portable, so you move directly to the carrier and you're paying them directly based on that move. I kind of call it like you're under the LPSS umbrella, but yes, you're dealing directly with the carrier, even though you're still under the LPSS name.
And the life insurance amount changes with age. With age, it's not retirement with age. I mean, it goes, the benefits go down as you get older. Which doesn't make
This-
sense. I know.
That's
When you need it, it'll drop.
Yeah, just so people don't.
Doesn't make
Is that the $5,000 benefit you're talking about?
No, it's all of it. Well, yeah.
But you can always get extra stuff from all the companies. They're always sending some stuff anyway, so you're not out of dental insurance. You can get it through an independent party.
Yeah, and some of the dentists.
You just won't be under the umbrella.
But me is correct, it's
I was just
very
gonna touch on
important
that
for
one.
people who are active employees to know.
Yeah, yes.
Yeah,
you need
set
to know.
yourself up.
Better get it while you
Before
can.
you,
Yes.
So with open enrollment, she's gonna be able to talk about that in a second.
yeah.
I just wanted to see your hand. So I don't think this is supposed to be a Q&A, but that's okay.
Well, I just didn't want to
Sorry.
speak up. For these other insurances, do you have to be vested like 10 years?
Oh, that's a whole nother discussion. Yeah.
For voluntary benefits?
Yes. In order to retire. So if they
Voluntary
get
benefits.
2 years before retirement, Just me to write that down in case I have to go in.
Voluntary benefits is different.
Okay, so Miss Katie touched on it, but I just wanted to reiterate, yes, there are numerous in-network physicians with regard to anesthesiologists. HUB did make a follow-up, we did follow up Miss Katie, I just wanted to make sure that everyone was aware. Ochsner's Lafayette General Medical Center. So the VCC went very well for the retirees this year. We had a large increase. We offered the physical at the VCC location like we always do. We offered it on 2 different dates, June 14th and June 23rd. We had a total of 104 retirees who went to the clinic, saw Ochsner's and did their physical. So that was great. Those numbers were a large increase from years previous. Typically we're around in the 20s or 30s. So it was a substantial increase.
That's great.
So that's great.
Push it out on motto advertisement.
Okay, the Blue Cross Blue Shield Wellness Incentive, we had started it about last year, if I remember correct. Ms. Carroll made a recommendation with regard to helping those retirees who don't necessarily have a computer.
Yes.
Our wellness incentive is the $250 credit that members are eligible for if they complete the items on the wellness incentive. So you've got to do an online assessment, which is on the computer. You've got to do a physical, like we just talked about with Ochsner's, Lafayette General. And then you have like some pick and choose items. I went to the dentist, that's one of them. I saw my physician with regard to vision. I did a 5K walk. There's numerous items within that wellness incentive to where if they make the 100 points.
And I know it's not a question and answer, but while I'm thinking about it, because I'm getting older and
Okay.
things kind of slide.
You got 100.
I better hurry up and ask.
Every one of us,
The physical has to be through.
No, it does not. But just like I was mentioning, those members who did go to that would be an eligible
If your
point.
physician is already a member of Ochsner's, that counts, right?
Doesn't have to be on Ochsner. You can go see your primary care physician, like I have a primary care physician, and that checks my box on the incentives for making those points.
It's just an opportunity that if you don't have a primary care, but you're lucky enough that you don't need a primary care, this covers that. So that's the opportunity that it provides you.
So Blue Cross is going to be in-house at LPSS again, fielding those phone calls from retirees. We're going to send out communications Wednesday, September 7th and Wednesday, December 7th from 9 to 3. They could call the 521-7066 number and you'll be routed to a Blue Cross.
I'm sorry, 7066?
7066, yes ma'am, 521-7066. They could be routed to a Blue Cross representative who can help them fill out that online assessment, which they may not be able to do if they don't have access to a computer. So we built that in directly for retirees based on Ms. Carroll's request about a year ago.
Medicare is
So-
not included?
We still want members who are covered under Medicare to participate and do that wellness exam because you catch those problems that you may have that you didn't realize, it's preventative. I think that's why our numbers increased, in my personal opinion. We tried to stress it was a physical, and we want you to stay healthy, and we want you to preempt those possible medical issues that you may have. And I think that's what hopefully drove the numbers up for regard to participation. But Medicare eligible members are not eligible to receive the $250 credit. However, it's because they have Medicare. We've reduced the premium. They're likely, if they see a physician that accepts both your Medicare and your Blue Cross, then they're likely not paying any out-of-pocket costs towards your deductible because Medicare's paying 80% and Blue Cross is paying the remainder. I always say you get more bang for your buck if you see a doctor that accepts both, and then it's next to nothing from the retiree with regard to if they have Medicare
You just
A
have
and
to
B.
meet your Medicare deductible and that's it.
Right, exactly.
That's
Yes, ma'am.
it.
So it's, but we still want them to participate. We want the retirees to participate, so we've made that offering that if they need help with a computer, to ring our office during those specific dates. Let's see, September 7th and December 7th from 9 to 3 at the number I referenced. We did include it on the retiree newsletter that we sent out, so that newsletter was sent to everybody with that same communication. So but if you missed it for some reason or if you've got additional questions, reach out and we'll help you.
Thank you, I'm gonna share that.
So we're on the cusp of bringing on the new hires. They're biting at the bit and they're coming on board here shortly. We've got our new teacher induction on the 2nd of August at LG Alamo. We'll be speaking to the teachers and librarians in particular. And then we have another one on 8/4 at David Thibodeau from 7:30 to 12. And that's going to be everybody else. So you're a custodian or perhaps you're a master teacher, because the master teachers don't teach in the classroom, then you would go to that orientation. So we're on the cusp, but we're communicating with them. We're going to bring them on board and then make sure that they're aware of all their benefits with Lafayette Parish, their payroll, their insurance and benefits, any leaves or policies. So we've got them, and then literally right around the corner from that is open enrollment, in particular for active members. It begins September 12th through November 11th. Where any changes made during open enrollment is a time period where members can make changes to their benefits and they don't have to have documentation. They can just say, hey, I want to drop my daughter who's on my health insurance plan or my dental plan, and they can make those changes at that point in time during open enrollment. We'll have EBI, Educational Benefits Incorporated, out at every single school location to talk to the members one-on-one.
They're coming back.
They are, yes. They've been out of the schools for a bit.
For a lot of people.
We're doing some face-to-face. We're excited that members are going to be able to talk to the consultants, review their benefits, see if they need to make changes. But EDI will go to every single school location, and insurance is going to put on a couple opportunities for members to where we're going to reach out and we'll have something aligned for them. That way we can make sure that if they need to make health insurance changes, they contact us.
Will they be providing a set? I know they've done that some of the time.
We're working through those small
Pay
details.
for this stuff, you will schedule yourself.
Yeah, okay.
Trish, is this the 3rd year of EDI's contract?
EBI's contract does not end until 2023.
So if you don't have any changes, you don't have,
You still have to
Yes,
always sign.
we're still asking that they meet with the consultant, review the benefits, because
Yeah.
your beneficiaries may be updated. Your
They're verified.
salaries have changed this year, so you may have
It's
short-term
quick.
disability.
It's quick if you have no changes.
You may want to
You can
increase your
remember.
disability.
shouldn't.
There's lots of, even small items. We want to make sure those beneficiaries, life insurance beneficiaries on file, we want to make sure point of contact is correct. That way members are getting the cards that they need and so forth. But yes, open enrollment will be here before you know it. And then I wanted to just provide, Ms. Nancy had asked in her report, points of contact with regard to insurance and who. Nobody has changed within the department other than my new additions. We've been working through interviews for the department. I don't have information on them because we're in the current process of trying to hire. But this just gives you our telephone number, our email address. There have been a few changes with the titles, and it tells you that we've now been reorged under Ms. Jennifer Gardner. So it's just informational for you, just tells you the changes that occurred.
Thank you for that, Trish.
You're welcome.
Anything else?
Just one more thing. You had also asked about the retiree communication. I put it in my staff report, that way you could get an update. We have been in communications with Blackboard effective July 1st. It's a 4-step process. We have sent them, we've gone through steps 1 and 2. The last step was the upload file to make sure that Blackboard has the correct communications of the emails, the telephone numbers, the cell phones, the home phone. That way we can make sure that we're communicating with the retirees. We're moving on to step 3, which should be training for the office members, staff. That way we know how to use the system and we're using it effectively. I'm hoping by likely the 2nd week in August, we'll get fully up and running to where it will be completely ready and ready to use. Because it's just, unfortunately, it's a step process. We've got to work through their process, they have to work through ours, but we're getting there.
You will likely have it to notify them of the Blue Cross Blue Shield availability.
When you say Blue Cross Blue Shield availability.
In December,
And
yes.
Oh, with regard to that, yes, exactly.
Great. Anything
And that's all I have.
Just out of curiosity, what would be the harm of allowing somebody who's retired, who's put in God knows how many years to get like dental insurance or something? What would be the ramifications?
It's not, retirees are not eligible to enroll under our health plan. You have to be an active member meeting so many hours, 15 for transportation, 30 for active members.
Bernell, tell them to go get a
That's a
job.
nice try, Bernell. I'll give you the name.
I'm gonna get a job.
School system, right?
We're for you.
All hiring. We're all hiring. Pick a job.
So
It's a trend. That's so neat, like, you know, in your career, you've had multiple, which one?
I'm sure you're curious. Right? I'm sure you're. What's that? We're telling your people about getting ready to retire because a lot of my principal friends got caught and it wasn't
the only one that's
human resources. But long-term insurance, if they have it,
I'm this victim.
they send you a packet in the mail, it's from LPSS, and you have so many days in which you have to start paying your own, otherwise you're dropped, and if you don't respond, your long-term is dropped.
It's to make it portable. You get that portable package.
It's the only benefit.
So they need to pay close attention. Yeah, but is it still, like, I'm having to pay mine
Oh, no,
individually.
it's been that way
It's not
for
up
years.
here,
I've been
yeah.
here for 7.
So, and they need to, either do a bank draft or something like that. But at least 2 of my principal friends lost their long-term because they didn't respond or they didn't open the envelope. And they had the teacher, so it's, I mean, it's nobody's fault other than theirs because they didn't do what they were supposed to do.
Time sensitive.
Yes, time sensitive.
Is there anything else anyone?
No, but I want to say thank you to Trish and all of them, because it sounds like they're really, trying to,
Compared to where we were
yeah.
back in the Claire Guidry days, it's been light
And
years.
Claire, who she doesn't remember the last name?
It's light years.
So thank you.
Let me ask you this question. Can we share this with all retirees? I mean,
Why not?
I'm asking, because you know if I said.
I mean, it's on our website, Ms. Carol, with regard to the updates. I'm updating those new members that we have for staff.
Like the retirees' Facebook, if I send it, they will post it.
I wouldn't put the reclass information, if you would like, we could get you a better list of
Right.
staff.
Send it to me.
How about that, and I'll send it, would be a better idea than maybe putting all of that information.
Is there a motion to adjourn?
So
moved.
October 20th.
Thank you for asking, Ms. Carroll.
Good.
It was our.
Is there a second?
A second.
Phyllis. All those in favor? Opposed? Look, it's not even 7 o'clock.
She's brand new. So, we're in that process. Priscilla's actually coming to us in Bylaw, so she's helping us start. I don't want to start sending emails